the Dental Place Cosmetic Spa to talk to Dr. Robinson about oral piercings and the growing trend of fashionable braces. Dr. Robinson, thank you for having us.
Thanks for having me. It's a pleasure.
So talk to us about the Dental Place Cosmetic Spa. How did you get started?
I graduated at the University of Virginia 12 years ago. My practice started in Florida, Fort Lauderdale, Florida, 10 years ago. I decided to expand that practice in this facility, so we've been here for about 2 years. I'm also an adjunct lecturer at the University of Technology. We graduated our first set of dentists here on this island last year, so we're excited about that. So being here at the office, I have an opportunity to introduce to my patients what I do cosmetically in Florida here. So I'm really excited that you invited me to speak to you about oral piercings, and especially the new trend in fashion braces, which are clearly not cosmetic.
All right, so you don't do piercings here,
No.
but I'm sure you have a whole heap of knowledge on piercings.
Yes, I do. I can speak on the impact of oral piercings on your oral health, but it's not something that we advocate or encourage.
Why shouldn't I get an oral piercing? I mean, everyone has them. It seems fashionable. Why not?
My job is to educate you on the impact on your overall health. The decision you make is purely yours. Oral piercings are, it's a body art, you know. It's an expression of one's individuality. Understandably so, it goes back to centuries, you know, where you find preserved bodies with oral piercings. It was a sign of ownership during times of slavery. So oral piercing has gone back for centuries. I don't see it going anywhere. Persons will continue to do it. However, without a basis, most of the persons that I speak to, it's done more because it's an expression of who they are, as opposed to just doing it because it's cool. Patients who are wearing tongue bars or persons that I know with it, they speak of increased sexual pleasures. To each his own, and it's a personal thing for them. So that's as much as I can say about that outside of an individual expressing themselves through body art. What we find with oral piercings is amongst younger persons, it is seen as a harmless way to express themselves. It's not seen as permanent as a tattoo or piercing of the ear. Because inside the mouth, especially the tongue, it is so highly vascularized. The minute you remove the tongue bar, it heals. So they see it as a way to get a piercing, mommy and daddy won't know about it, or my employer doesn't know about it. It's not even an issue of, in the workplace, it being known. It impedes your speech, it affects swallowing, and you know, there are a range of risk factors that goes with having oral jewelry in your mouth. And those would be, for example, at the time when the piercing is done, the concern is for prolonged bleeding, obviously because your mouth is highly vascularized, meaning there are lots of blood vessels in that area. Infections, pain, and swelling. So once you're healed, there's still concern, all right? Concerns would be cracking your teeth. The tongue actually seems to be the most common place for oral piercings. And second to that would be the lips. So here is fracturing of the teeth, receding gums, buildup of plaques in the mouth, and we know that the buildup of plaques will lead to gums being infected, which leads to bone loss, and which leads to loss of teeth. Persons who are doing this, youthful persons, are not aware of the risk factors. So I find it important to communicate what I can on risk and educate. I don't think that we are as informed as a public as to the consequences to some of these decisions that we are making. And so the tendency is to do it for fashion, and dentistry by itself is very costly. I know that because I have patients who struggle to do basic stuff, such as regular cleanings and fillings. So it disturbs me when out of fashion you do piercings, and then you end up down a road or path where you lose your teeth, and it's depressing.
When we return, we delve a little more into the effects of oral piercing. And still to come, what are fashion braces? Welcome back to The Good Life. This week we are discussing the effects of oral piercings and fashion braces with Dr. Sharon Robinson from the Dental Place Cosmetic Spa. So you've mentioned tongue piercings and lip piercings, but I know a lot of people are getting their cheeks pierced. Are these considered oral piercings, and are they as harmful as a tongue piercing or a lip piercing?
Yes, cheek piercing is also considered oral piercing because it extends from the inside of the mouth to the outside. It does carry equal risks as the tongue ring or bar and the lip jewelry.
Dr. Robinson says most persons only focus on the look of piercings after it is done. However, she emphasizes a major precaution that should help persons to at least stop and make the best decision.
Basically, from the onset, walking into a facility that's not regulated, we don't know how the instruments being used are being sterilized, if at all. So there are concerns for cross-contamination. The National Institute of Health has identified oral piercings as a risk factor in transmitting some hepatitis viruses. There is the concern for endocarditis. Contaminated instruments or health concerns that you would have could create a situation where bacteria in your mouth now has the opportunity to enter your bloodstream. Once it's there, these bacteria can attach themselves to heart vessels. That's called endocarditis, and that can be a very serious complication. There is just too much, when a patient comes in to see the dentist, we go through a medical history for a reason. We don't know that these things are being done in these facilities because there are patients who say they're diabetic or they have some underlying medical problems that are not shared, and the persons who are doing the piercings are not trained to handle that. So in terms of maintenance, there's no maintenance once you've had your piercing. There's no follow-up. So you still have to get your dentist to help to manage what's happening.
I know you don't advocate getting oral piercings, but let's just say I'm all about that life and I'm gonna get one. What advice are you gonna give those people that are still gonna go out and get an oral piercing? What are some things that I need to keep in mind?
Get with your dentist, get with the dental hygienist, stay on top of your checkups. You will be informed on the safety precautions that should be in place. You will receive the professional help that you need for your oral care, for hygiene. And it's very important to minimize the consequences and the risk factors. that are there. So if you already have it, hey, that's fine. We're here. Do not stay away. Let us help you to manage that. I can't speak of what's going on in these facilities, if the things are being cleaned or not. And there's just too much. I have a lot of respect for things that I cannot see, bacteria and viruses. So it's so important for me to inform the public that they have a responsibility for their own health, and the choices that they make will have consequences. If they're not properly informed, there will be dire consequences, and more costly as well.
Let's say I put in a tongue ring and it chips a tooth, and I have to come in and get that repaired. How much money am I looking at for that?
That's a good question. First, we have to, how big a chip is it? It could go from just a filling to having a root canal and a crown. So if it's a small chip, we may be able to just fill the tooth to restore it. If it's a huge chip, which has now involved the canal, we have to remove the nerves, which is a root canal, and we have to restore the tooth with a crown. That gets very costly. So there it is, an inexpensive, fashionable decision to a decision here. From the top of my head, you'd be looking at about $180,000 to replace or to restore that on the high scale if you're doing a root canal and a crown. Filling anywhere from about $8,000 to $20,000 Jamaican dollars.
Underlying problems without symptoms is usually the reason most oral piercing infections get out of control. Dr. Robinson re-emphasizes the importance of consulting with a dentist.
The mouth, in its healthiest form, is loaded with bacteria, in its healthiest form. So imagine in a case where you're not getting the regular maintenance that you need. For persons who have lots of cavities or abscess teeth, or their gums are unhealthy from having a lot of buildup on their teeth, the level of bacteria in your mouth is that much more. So therefore, with your mouth loaded with bacteria, now you're at higher risk for infections. For persons with oral piercings, swelling around the areas or the area where the piercing is, if there is any redness, pain, you should get it attended to, because it could be a sign that there is something else going on. That's usually the first sign of an infection, and you don't want it to try to fix it on your own. So a cheek jewelry can now wreak havoc, because it creates an environment for bacteria to not just adhere to the metal itself, and we'll talk about that later. These metals provide a safe haven for them to adhere to and create further problems. So you don't want to do that. So get the help that you need when you start seeing that something isn't right, and either remove it, heal, put it back, or, I will say just take it out or don't pierce at all. But if it's there and you have to, we'd have to take measures to remove it, get you healed, and if you have to and choose to do it again, it's up to you.
We've just talked to Dr. Sharon Robinson about oral piercings, but there's more. We'll be right back.
DamnGoodBeats.com.
I'm here with Dr. Sharon Robinson, and we've covered a lot of ground talking about oral piercings, but now it's time to discuss fashionable braces. What are they, and who's getting them? So what are braces to begin with?
Braces are devices used in dentistry by orthodontists who are specialists in our field. They are used to align and straighten teeth as it relates to your bite, and of course improve your overall oral health as it relates to that. The decision on the kind of braces that an individual will have will be based on an analysis that is performed by the orthodontist. So there could be metal and ceramic, there could be all metal, there could be all ceramic, there could be just Invisalign that is done.
Dr. Robinson, we've established what braces are. Let's talk about fashionable braces. What are fashionable braces and why are they considered fashionable?
Fashionable braces, as the public perceives it, I must say this growing trend, I find it somewhat disturbing for different reasons. It's similar to oral piercing, that one would subject themselves to receiving treatment by persons who do not have knowledge or proper training to place these devices. So there is talk of this trend of persons who are receiving braces on their teeth by someone who is not a dentist, not trained in the field. Are these things sterilized? Where do they come from? Is there maintenance? I don't know what is being done. The little I know of this trend at this point is the brackets are on the teeth, but not engaged. Meaning, when brackets are placed on the teeth, there are wires that act as tracks for forces to be applied over time so that teeth can be shifted. All right? Continuous force over time. What I'm learning of this practice is that part of it is not happening. So the brackets are just on the teeth with pretty bands, and patients are loving that. Here's a problem with that. By itself, just having these brackets on creates an environment where you're at higher risk for cavities, a higher risk for poor gum health. The adherence of bacteria to these metals, we talked about that with oral jewelry. You see that with brackets. It's more challenging for those who are wearing braces to clean it. And any persons you know, have you worn braces before? There tend to be a lot more buildup on these braces because they're metals or ceramics. So more cleaning has to be done. The longer these buildups are on, you run the risk of getting cavities and gum problems. It's more costly to fix these problems than to go to someone who's not trained to do it in the first place in the name of fashion. I've had to remove devices such as these from persons who would just wear it, but they can't afford anything else. What happens? You remove these brackets, there are cavities on teeth, the gums are in poor health because of the inflammatory process that starts in the mouth. And teeth will easily shift because there's no wire that's aligning it. So these are just brackets that are being put in your mouth. I don't know what it's made of. I don't know where they come from. But I find it disturbing that persons are doing that. And dentistry is very costly.
What I'm trying to understand is when they do get these fashionable braces, the intention was to straighten the teeth to fix an issue, or was the intention to make it appear that they had braces?
There are different reasons why we seek out cosmetic services.
Okay, so
there are those who need it, and there are those who just want to enhance, just a little extra. On the outside, when someone wears braces, you see a beautiful smile after. Teeth are straight, perfect. There are those patients who cannot chew properly. there are those patients who have other problems that are more severe who are required to get braces for that reason. It has nothing to do with cosmetics. The benefit of cosmetics is like the bonus, all right? So for those persons, it's almost like an insult because people want the end result, but the proper planning does not go in place for that to happen. As dentists or any medical clinician, if we are attempting to do a cosmetic procedure on a patient, the first order of business is to begin with the end in mind. Hence, time is spent during the treatment planning process, understanding why the patient is doing it, what their needs are, and all that plays a vital role. This fashion trend, I am not sure what is driving that, except to say there are persons who just like the look of braces, because if you are not trained to use these devices, you cannot straighten teeth. You can't. It is such a technical process. These orthodontists are trained for at least 3 years after receiving their dental degrees and license. I find it disturbing that persons in the public will do that. Now, my only answer to the reason is lack of information, or they're just not aware. I do not know the cost for fashion braces. I just know that I hear numbers of it being anywhere from less than $20,000 to maybe $50,000. Yeah. So I don't know what it's made of. I don't know how they get it. You have to have a dental license to procure some of these items that are used in dentistry. So I don't know where they're coming from or what it's made of, and it concerns me because I don't know how it's being done, and the persons who are getting it, in the end, it's going to cost them more. Cost, for example, you lose your teeth. Gee, there's a lot of value in that, because now your options would be dental implants. Can you afford that? $3,000 per tooth, approximately, US. Or wearing partials and dentures. You don't want to wear partials and dentures after making a choice like that, because it's my patients who are wearing dentures, they don't like them, but they have to wear it for function so they can chew properly. But the desire is there at some point, I'm getting out of these things. So yes, they need to not do it. Keep your teeth the way they are. It's too costly to put these braces on to end up losing value of what you have now, because you can't afford implants and getting dentures. Even though it may be affordable to get dentures, the quality of life is different. Patients who wear dentures will tell you kissing is not the same. Food does not taste the same, because these plates cover taste buds, you know. So it's not a pleasant thing, you know. I get to baby my patients and take them through the process of it, but it's not something you want to desire.
Thank you, Dr. Robinson. I'm sure our viewers have learned a whole lot in regards to oral piercings and fashionable braces.
You're welcome. It's been my pleasure.
All right, so there you have it, guys. It's costly to keep up with these beauty trends. Maybe you should think twice before getting an oral piercing and before putting in fashionable braces. I've been your host of The Good Life, Amita Prasad Webb, and check us out next week.